let's get the conversation started today. I have the great pleasure of being able to introduce Senator Colleen Burton. She serves as the chair of the Senate Health Policy Committee and represents Florida's District 12, which is part of Polk County. She served in the Florida's House of Representatives starting in 2014 before being elected to the Senate in 2022. Senator Burton has served on many different committees, including House Appropriations, Ways and Means, Transportation, Senate Judiciary, and many more. Other career experiences include serving as president and principal consultant of C. Burton and Associates, community engagement manager of the Central Florida Regional Planning Council, and executive director of Polk Vision Incorporated. Senator Burton earned a Bachelor's of Science in Public Administration from California State University at Sacramento. So please welcome Senator Burton. Joking about how low the chairs are, so we're settling in.
But I appreciate that it's not a bar stool or a high top, because those are really hard, really hard for me. So good morning, everybody, and good morning, Beth. I'm really happy to be here with you.
Thank you. It's a pleasure to have you.
Great to be here.
Great. Well, we are so thrilled to have you here. We would be under any circumstances, but particularly this year as a momentous year with a huge healthcare package that you sponsored and shepherded through the sausage making that is the legislative process. And we really wanted to talk today mainly about Live Healthy and the other parts. It's a package, right? It's a conglomeration of bills that's going under that header. So I think just to start out, if you would tell us a little bit about Live Healthy and what you would want this audience to know about this omnibus healthcare bill.
Sure, thank you for that. I think, we'll start with why. Why did we feel it was necessary this session to do what I think is, to quote my friend Senator Harrell, the most comprehensive piece of health care legislation in the country. And Florida, has unique opportunities and unique challenges, and Senate President Pasadomo is certainly very keenly aware of that. Those of you who pay attention to the process here in Florida will remember that not this past session, but the session prior, the President's priority was housing and also environmental issues. But we had a bill called Live Local, which provided some opportunities to help with the housing crisis that we have here in Florida for everyday workers, for people all over the state. And I've seen, I know in my own community, the development that has already taken place because of that initiative. So a little over about a year ago, the session was over, and the President let me know that healthcare was next, that she believed, and correctly, believed that we were near, if not at, a crisis point in access to healthcare in Florida, and I knew we were. I absolutely knew we were. I've had the great privilege of serving on healthcare committee the entire time I've been elected, and the last, 4 years chairing big healthcare committees in the Senate and the House, and then also subcommittees in the House. So I just have time in, right? So I heard a lot of stories, I knew a lot was happening, and we all know how Florida is growing. And we all know that we are getting well over 800 people a week moving into our beautiful state. And they do not come with a proportional number of healthcare providers down the road. We don't have people coming here to take care of them. We were all across the country keenly aware of the nursing shortage, particularly during COVID. That was brought home all across this country. At the same time, we had a growing and emerging healthcare provider at all classification crisis and shortage here, not just in Florida, but in the country. So what Florida is doing, and what we will be doing with Live Healthy, is setting us up to be the place where people can move, can live, can work in healthcare if they want to. It will improve access all across Florida, regardless of a Floridian's insurance status. If you're uninsured, you're on Medicaid, you have what you think is a great plan. Everybody's having challenges. Everybody is having challenges. So the multiple components of this bill speak to so many different areas that some I was more aware of than others, and some the president brought to the table, and some were obviously brought to us by numerous stakeholders across the healthcare spectrum to include patients and individuals who just call us all. I get calls all the time. I know my fellow legislators do as well about difficulties in accessing healthcare. This initiative, the Live Healthy initiative, it was, I think, in the end, maybe it just grew. It started with 7016, which was the Live Healthy bill, which was the longest staff analysis I've ever seen. 230-something pages, and I'm one of those crazy legislators who reads the staff analysis for the bills that I run. But in doing that, I thought I already knew a lot. I knew a lot about the bill and the components of the bill. I got an even a refresher course, if you will, on access to healthcare and what the state of Florida looks like related to healthcare. So very appreciative of Senator Pasadomo's willingness to trust me at the helm, if you will, of at least leading the process. And working with her through this process was one of the great privileges and really joys of my legislative career so far.
Maybe you could tell us a little bit about, kind of in the broad strokes, what are the different maybe categories of issues that the Live Healthy package tackles?
Sure. A lot of people, I will say a lot of folks thought, and early on I would hear, oh, we hear you're doing a workforce bill, because we know workforce, that's a big part of it, right? So there's a lot of things related to workforce, from GME, expansion, more slots for GME. There's funding in there. Actually, we put money in the budget to help pay for some of our, if you are a provider in the room right now, you will, and you care for Medicaid patients, you all are going to say you need more money. We hear that all the time. But we have some provider classes that were, for example, for those who care for our APD population who had not received any meaningful increases in many, many years. So the president and I and staff looked at where are the greatest, where can we have the biggest impact on folks who are the least secure, right, in our state. That population, and certainly we've heard a lot from particularly hospitals and others about the challenges related to maternity, pediatric care, those types of things. So there was, funding was part of it too. There was that. So that, there's a lot of workforce. One of my favorite components of the bill related to workforce is our frame and dental frame, which is tuition reimbursement programs. We had done it, we started doing it previous to this last session at a smaller dollar amount. And it was a huge success. Money just flew out. So we thought, well, what more can we do? And I don't have the number in front of me, but it's a lot of money. But a lot of money. We expanded the class of practitioners who are eligible, so that we now have, we have physicians, we have nurses, we have LPNs, we have mental health care providers, we have dentists, dental hygienists, and what it does, it's an incentive for the providers to provide care in underserved communities in Florida. And this is something I learned by reading that staff analysis. If you look at a map of the state of Florida, big, long state, right? Outside of the major metropolitan areas in Florida, the Miamis, right here in Tampa Central, Orlando Central, not where I live. We're medically underserved in Polk County where I live. Most of the geography of the state qualifies, which I thought was great, because I thought that's wonderful, because that means there's that many more places and locations where healthcare practitioners, from physicians, like I said, to dentists and others who work in healthcare, that'll be an incentive for them to go. So I'm very excited about the more immediate response that I think that'll help us bring. So we had that. I mean, education I already mentioned. We invested. In the past, we traditionally looked a lot to the federal government to expand GME slots, and we said we can't wait. So we expanded some of the things we're already doing, put our own money where our mouth is, so to speak. We're going to support it. We need to make this happen. We've got some actually younger students who go through programs, pathway programs with some of our universities. We've expanded that. We have also opened up opportunities for physicians, particularly physicians, to practice in the state of Florida who've had some challenges, kind of unnecessary challenges, I would say, to overcome before they could even move here and practice. I mean, some of the things that, the challenges that those physicians were having based on where they were, particularly we had foreign-trained physicians, highly trained physicians, who were teaching at our universities. And some of our universities were instructors at universities. Some of the professors at universities were limited to how many of those individuals they could have on their faculties. That made no sense. And then it really makes no sense. We trust you to come and train physicians here in Florida, but, oh, by the way, you can't practice unless you go through we put you through all kinds of hoops. The hoops are still there. The hoops are still there. They still have to be highly qualified, but we're making it a smoother transition for that. So that, I think, will have a more immediate effect as well on the education component part of it. We have, I want to say, provided greater access in 2 different ways to individuals in Florida who access their health care at free and charitable clinics. This was something I know was very dear to President Pasadomo, and that was to include in our tuition reimbursement program a volunteerism component. Her father has passed away, but her father was a physician, volunteered a lot, and we made so there's a volunteer component to that, and it's very important, especially when you tie it with, we created greater access to free and charitable clinics by increasing the level of poverty that somebody has to be at, in order to use those services from 200 to 300%. So we're going to send them more patients, and now hopefully we will provide them more doctors and nurses and others as well, and dentists who practice at those clinics. They're all across the state. So that's, that's that part. We joined a couple compacts, which, compacts to me, or we'll see how it goes kind of a thing. We do it because our physicians here in Florida want to be able to, like so many physicians in the world, in the era of telehealth, they want to practice all over the country. They want to practice wherever they can touch a patient. That makes a lot of sense, right? And we don't want to limit folks in Florida who want to do that. We're moving into, it's very specific, but we're moving forward in some of that. It just goes on and on and on. The point being, we have some things that will have more immediate effect, I think, as I mentioned earlier, and others. And are you going to ask me yet what my favorite thing is? You want me to just launch in?
Yeah, go for it, because I was going to ask, what is your personal favorite
I can tell you, because I've saved that one for last. So if anybody's in the room followed me at all in the House and in the Senate, I did more than one panel on emergency room access and the use of emergency departments across the state of Florida for non-emergent care. We talked about it when I was in the House. I did a panel on it not even this session, the session before in the Senate, because it's a problem. And I know it's a problem. I knew it was a problem. I've heard about it. I've seen it. I live in Lakeland, the second busiest emergency department in the country. What? And who's going there? Well, what I know just as an individual in the community and as a legislator, 10 years ago when I was first elected, individuals would go to an emergency department largely because they didn't know where else to go. They didn't have a primary care physician. So that's where they went. Some hospitals across our state started developing programs of their own, in-house programs, where they would see that patient, because you gotta see them, and you should, see them, but then have an arm of the work that they do as well that provided primary care. So they could then transition them into a primary care situation. The one I'm most familiar with is the one from Lakeland, because that's where I live. But so I'm open to go visit others, by the way, everybody. But what I liked about the one in Lakeland, for example, at the time, the last stop they had was with a social worker, a case manager, somebody who walked them through the applications for what they might be eligible for. Cool thing. Because for people, that's a lot. It's cumbersome, it's scary, right? So so in Live Healthy, working with our hospitals across the state as well as our health plans, we included language in there that builds a tent, I'd like to say. We're gonna have a tent. And it's gonna be the places who touch the most patients in this state. It's gonna be hospitals, it's gonna be the big healthcare plans. And if somebody comes to the emergency room doors and you're gonna take care of them and do great work, and we do have great medical care here in Florida, what else can you do to help that individual then move on to the more appropriate follow-up care, to connecting them with primary care here in Florida? So there is a role now for hospitals to have in that. There's also a role for our health plans. When I was first elected, and if any health plans are here, good morning, I would meet with health plans, and I would say, what do you do about case management? And, oh, we do that. That's all I kind of would ever get. I wanted more detail. How do you case manage? Because I know that just, individuals being great advocates for themselves in healthcare is a challenge. It's a challenge for people who have a history of going to the doctor all the time when they need to go. I live with a man for whom this is a challenge, so I'm really aware of that. I am his healthcare advocate going, you need to go do this, right? I mean, we all oftentimes need somebody who does that for us. Well, now the health plans are going to play a bigger role in doing just that. If you get a new plan member, somebody becomes a member of your plan, in 6 months, we need them to have seen a primary care physician. And if they haven't gotten there, and it could be you do all the things you can do, we want to know why, right? Because that could be, well, okay, what do we do? How do we help people begin to learn and understand how important it is just to get an annual checkup? Keeps you out of emergency departments, helps with any chronic issues you might have, any emerging issues that you might have. So that to me is, that's big, it's important. It will make a difference in the lives of millions of Floridians just doing that, yeah.
You guys got all that down? There's going to be a quiz on the different parts of the bills, and it's huge. It's so many different issues that I think we've all known about for so many times, for so long. Emergency department use is one of my favorite issues too. How did you kind of decide what was in? Obviously, there's probably things that didn't make it in that. Maybe are for a later time, but what was kind of the process of prioritizing and thinking through what was most important?
Well, thank you, that's a good question. It was a long process. It was, quite frankly, a lot of, if plotting and working on legislation can be fun, it was fun for me. I absolutely enjoyed working so closely with the president, who her perspective, a brilliant woman. Perspective, though, is different than mine, right? Because I've chaired health committees, and I've been in the weeds. I'm in the weeds. Now, President Pasadomo knows me very well. There's obviously a reason I did the bill, and then I'm chairing the health in the Senate, at least this term right now. I loved that. And then when she basically sprung it on the world at a dinner we attended last year, I think it was Florida Hospital Association, where she announced to everybody in the room that I was carry the bill. And she also said that Senator Mayfield was going to make sure nobody got in my way. So there was that part. But that's when it came, and I knew already. And I just right away said, well, what do I do? How can I help? Where can I be? So the president began, of course, as soon as that's out, everybody wants to have meetings with the president. And meetings started. And, clearly the president had some thoughts she came with, some ideas that she already had, obviously. I had some of my own as well. So we took a lot of input. People would meet with the president. They would meet with me. She would bounce them to me, usually, to get more detail, to find out more about what they wanted to do. It was a lot of input. There was no big, huge meeting where we had everybody attend. It was, which was a good way of doing it, I think, too, because, entities, individuals across the state, when they became aware of what was happening, they just started calling. And the president and the president's policy chiefs who were in that area, and our staff in health in the Senate worked nonstop, really, really hard. And the drafts and the redrafts, and we would meet, and I would go to Tallahassee, and the president and I would meet with staff and toss out some ideas, because we thought, one of the things you wanted to look at, well, we're looking at something to make a difference across the state. Is this going to have a stake, or is this just some individual little project that somebody wants somewhere for what they do? It might not be a bad idea, but it doesn't fit. So you had to do that, because we heard lots of good ideas, but they weren't going to make an impact statewide, if they weren't going to increase access through workforce development, the other things that we've got in the bill. Is that really what we needed to do? So it was hard. I mean, I got a lot of meetings. Yes, during committee weeks, a lot of meetings where I would listen. I have a reputation for saying yes to meetings, right? And I wanted to talk to people and hear what they had to say. So it got to a point for me, it was fairly easy to say, well, that's not going to fit this. And so it was just a process of doing that and looking at things, like I said, working with professional staff, certainly working with the budget staff. I mean, we have committed in recurring dollars between the multiple bills that are under the Live Healthy initiative, close to $1 billion. It's a big deal. Live Healthy alone was over $700,000. We did sunset some of that. This was input from the House. Some of those dollars are sunset in 10 years. 10 years is a long time, and that's appropriate, and it gives us time to measure then, because there is measurement in this bill. One of my favorite things. There's measurement in the bill, so we will, in 10 years, 9 years, we'll start looking, get an idea of what's happening and what difference we hope it's making, that we'll know that it's making. So, that happened back and forth. And then, as you mentioned, there were multiple bills then too. The technology bill that Senator Harrell has, the innovation bill. We have heard, and I love conversations around innovation and technology in healthcare. I love visiting a healthcare provider, usually the big hospitals, that have all these just cool, amazing. I've actually done panels on that in my committee as well. I'm a fan of hospital at home. We have urgent care at home now. All these things, because if anybody's been a patient or knows a patient, we've all been there and known somebody. We all know that people heal better in their own surroundings. And if we can do that safely, and they get the care they need, fabulous. And what we know now is that readmits on hospital patients who've had some of their care, because they may be in the hospital first, but we get them out sooner, and then they get continual care from the hospital, their readmission rate is lower. We already know that. So the Innovation Council is going to be formed, and there's going to be dollars going out in the form of loans to entrepreneurs around our state who have some great ideas. So now I'm getting those phone calls. I think they think that somehow I'm going to dole out the money, which I'm not. But
she's not.
But those phone calls are coming, and they're really interested and exciting. I mean, it's kind of exciting to see that. Behavioral health. How long have we heard about challenges in behavioral health here in the state of Florida? As long as I've been in the legislature, so prior to that, right? I have seen so much movement just in the last couple years on that. And, behavioral health teaching hospitals, hello? That's exciting. That's exciting. So a lot of just things that I thought, okay, that needs to be its own thing. And some of them start, maybe percolated up a little bit late in the process too. And you're thinking this maybe deserves its own standalone bill opportunity so that people know how important it is, I think, to us too. It's all important, but if we still wanted to do it, we did a standalone bill for that. Yeah.
I think it's striking that the package of bills really, didn't just touch on medical. There's dental and there's the behavioral health component as well. And so I think that's interesting. And the different levels of practitioners to help expand the access that way is exciting as well. Did you find, so you've got all these different constituents, you've got people coming out of the woodwork to tell you their ideas. Did you find that you had sort of who were your biggest cheerleaders? Who was the big force that kind of helped push things along, or did you find any bumps in the road along the way?
I'd say it's our biggest cheerleaders were other members. Our biggest cheerleaders were other legislators who live in communities across the state, who hear from people. They had a lot of meetings, so they weren't always our biggest cheerleaders, but they really were across the board, bipartisan support for this. So I think the president knew as well, we knew this was the right thing to do. We knew this was right for everybody in Florida. And I would say across the board, nicely, I wasn't surprised, but I kind of was surprised at how supportive everybody was. I prepared the day that I presented the bill on the floor. If you watch us at all, you know that our good friend, Senator Pizzo, is really good at asking those tough questions, right, on the floor. I prepared as if Senator Pizzo was going to ask me questions. He didn't ask me a question. I'm like, geez. All right, I was right, because he reads staff analysis too, so he knows. That's the thing. They engaged. They knew the bill. They would tell us if they had conversations with if people came to meet them. There was really a big family project, so to speak. People, we communicated with each other, which was so wonderful. Our biggest cheerleaders. But I would say everybody, every entity, every individual, every medical student in this state, I mean, they're all cheerleaders. They got on board. Not everybody got everything they wanted or got it exactly how they thought they wanted it to look, right? That's normal. That's normal. But every entity could see something in the bill that was really, really good, and that they knew would make a difference, not just in the part of healthcare in which they practice or their business entity participates, but also clearly could see what a difference this could make for every Floridian. I think that was true. And once people got beyond, because we have lobbyists who come to visit us, and we know, you're there, this is your thing. This is why you're here, we know who you work for, you know the story, you know what you've got to talk to us about. So you have those conversations, and oftentimes you might pull a nugget. You won't do the whole thing, but you pull something. So I think the willingness of the entire healthcare community in the state of Florida to engage was remarkable. I appreciated it. I appreciated it a lot. The president, I know eventually she did, even though she had a lot of meetings with a lot of people, because I think they thought, if we can get the president on board, and then the president would say to me, what do you think? Sometimes I didn't say it was a good idea. So we didn't, we went back and forth on a lot of things. It was a great process. I enjoyed it.
Yeah, that's really striking to have that many groups and that many legislators on board with an issue. Were there stories that you heard about the experiences with the healthcare system during the process or before that stood out to you, or anything you heard from your fellow members?
That's great. I am close to in my community our FQHC. Ann Clausen is the executive director or president. I'm not sure what Ann's title is of Such Florida Healthcare. So she talks to me all the time. She sees me at the grocery store, she talks to me all the time. So I had a lot of knowledge about what it was particularly like for that population of people and for the struggles that those entities that FQHCs go through to try to provide care. So I heard a lot from her. I always hear a lot from her ongoing. But it was what made this bill an easy sell in some ways to members was I could honestly say to members, like I said to you all earlier, either you or somebody you know has had difficulty getting a physician's appointment, right? Yes, we all have. You know somebody who's having a hard time getting in to see XYZ provider, mental health provider. In some places, dentists, depending on where they are in Florida. Challenges are everywhere. I spoke to a group of urologists. One room just like this last summer. And I said, I had a very senior gentleman in my family who needed one. And I said, does anybody here practice in Polk? I was like, it was hard just to find practitioners across the board. I know just personally, we all heard it. Interestingly enough, now that when you do the work that I do, and you're the age I'm at, you see a few physicians in your life, right? So my primary care physician has been my physician for years. And he never talks politics with me, never talks policy with me, talks about where I am, mostly like geographically, wants to know where I'm going to be and stuff like that. But I saw him about, a month ago, recently. And he said to me, I know you do something in healthcare, right? A little something. He goes, he loves family practice, loves it. He goes, but it's getting harder and harder to find specialists. He goes, if I have somebody who needs a neurologist, I'm sending them 300 miles away. It's really hard to find specialists. I said, thank you for that info, Dr. Wittig. I know. We are working on that. We are working on that. So I think, and it kind of goes back to what I said a little bit earlier about, emergency rooms. I never really finished, we knew 10 years ago. What we know today is that emergency departments across the state are seeing folks with fevers and headaches. Those are the two top codes that come in from our Medicaid health plans around the state. Fevers and headaches. That's not an emergency. It could be the kind of headache that it might be, but the point is probably not emergent care needed for that. And we see that. We see folks, I had somebody tell me about their mother who has a chronic health condition, could not get in to see her specialist. So she went to the emergency department because she knew they would take care of her. And they do. And they've got the equipment there. So if you've got if you've got a problem, they're going to take care of you. I want emergency departments to be able to do the good work that they do for people who really need them to do emergent care. Floridians would be better served at other places besides that. So yeah, it's real life, and I've watched the change. I've seen the change, and talked to people from around the states, friends of mine around the states. Same thing. I mean, I've family here in the state of Florida. Same thing.
Yeah, absolutely. I think we can all probably share a story on that. Well, we've come almost to the end of our time, and I want to make sure we have time for a few questions from the audience. So if you have a question, if you could raise your hand, and someone will come to you with a microphone. So please start that. And as you're thinking of your question, I'm going to ask you one last question. What is the unfinished business here? What is the thing that needs the next, maybe not something of this size, but the next bill or the next tweak that you can think of?
I'm glad you asked it. One of my soapbox issues, if you will, for me has always been, is communicating to Floridians in every community about how they access healthcare, right? We can build the best infrastructure, if you will, in healthcare in the world. We're great. We're going to get better. But if Floridians don't know where to go, if they don't know how to get there, what to do, it could be, that'll lessen the effectiveness, and it'll be, well, it's great you have all that, but nobody knows about it. I'm not, and so now when I speak, my chamber asked me that when I speak to them, that feels more community-driven than government-driven. Because what I know is, what I absolutely believe is, folks don't want something coming in the mail. I don't know about all of you, but if I get something that says State of Florida, I think something's bad in there. Yeah, what? Or they don't, I'm Secretary Weed, but I don't want an ACA envelope coming in my mail too. Any of these. You want to hear from folks you know. And I know there's innovative things happening around the states. I know that some physician practices and hospitals are doing, community awareness events at barbershops where they talk about prostate cancer and things like that to that population. They're getting out there and doing things. We have to do more of that. But that, to me, is very much a community-driven, a provider, if you will, driven process. And so I think a conversation about how we do that is necessary. Absolutely necessary. And maybe that's where the legislature does play a role. Maybe by advancing the conversation and being the convener for that conversation about, okay, docs are going to be there, the dentists are going to be there, the mental health, we're going to have them. How are you going to get them there? How do you get them there? And we're going to force people, right? But I want them to know that it's available, how they get to it, and that it's a welcoming, warm place where they're going to get great care. So that's just, in my head, that's a big thing. How do we do that? And we got to figure that one out.
Wonderful vision.
We got to hear that one out.
Any questions? We've got one right here in the middle. And thank you for those remarks and sort of describing how this process came about. It's been a great thing.
Hi, Senator. Thank you so much for speaking with us today. Your excitement and your passion is evident, and I think that that's always exciting when leaders are passionate about what they do. My name is Savannah Queen. I work with Find Help, and I used to be a community engagement manager, so when I heard that in your background, I was like, oh, that's exciting. You mentioned a community-driven approach, knowing where resources exist and being able to connect with them, specifically around traditional healthcare, dentists, specialists. You mentioned social care navigators and case management. I'm curious, how do you envision the community, so not just traditional healthcare, but food pantries and housing and all of those pieces that also are incorporated in healthcare? How do you envision them being engaged in the Live Healthy, and what's your call to action there to make sure, again, the whole community is bought in to really supporting Floridians?
That's a great question. I have actually already had a meeting in Lakeland on this very topic. There's an organization in Lakeland called Lakeland Vision, and a lot of our communities have, big overreaching, United Ways, it's other big community organizations, right? And they had me come to give them an update on Live Healthy, tell them a little bit about it, but they also want, their real question is, what do we do? how do we help implement this? How do we help get the word out and make sure that people know where they need, that it's available? And I said, that's your challenge. But I think you just brainstorming, how do we get people places? How do we get information? You take the information to where the people are. You work with churches and make sure that I've had a conversation with somebody about speaking to a church group already. I don't need to be all over the state of Florida speaking to church groups, but there are other organizations that do that kind of convening and community. 67 counties, everybody's got one, big, small, they're all different. But here again, let's talk. How do you do this? Let's get you all together. How do you do it? I think the Florida Chamber I know, interested in this. Okay, great. There's a role that the business community can have in this as well. Because what's good for health of Floridians is good for all. It's good for all of us. It's good for Floridians. If you're a business person in Florida and you're not in health business, it's good for you. It's good for you to have greater access to health care for all of your employees and the people who spend money at whatever your place of business is. But I do think it's broadening that community conversation around that. And at the meeting I was at, they also had, so I spoke, and then they had a panel that was Polk Department of Health was there, and Clausen, who I mentioned earlier with the FQHC, was there. Somebody from the hospital was there who actually manages residents. Wow. That's got to be crazy, but the residents in the hospital, they were there too. So I was really very, very happy to see that my hometown community was so on the ball. But I know other communities around the state have similar organizations, conveners, if you will, who bring people together to talk about important issues. This is an important issue, and how do we do it? And there's been some studies and research done, and I wish I could remember her name. There's a physician, PhD, I should say, out of University of Florida, who came and spoke to our House committee when I was in the House and talked about, you mentioned food banks, talked about that very thing. How do we get into communities and just talk about health in general, right? Food is a big issue. Food insecurity, but healthy food, how do you know? So they were doing community gardens, they were doing those types of things as well. So that's what I'm saying, it's a community thing where perhaps we in the legislature have a role in convening that conversation and helping make that happen. But I think it's most effective when it happens at home and the people who know you are talking to you. So I'm interested to know, for example, I was talking to April earlier about, I'd love to know if in other states they're successful at doing that. How do we do that part? Because that's really important.
Well, that is a perfect way to end this segment, because this is a conference about connecting with each other and finding ways to collaborate and finding ways to push good ideas to each other. And so I hope you will join me in thanking Senator Burton for coming to be with us today. Thank you. This is wonderful.
Well, thank you, Beth. It was great. It was great to just talk to you to get ready for this morning. But also, I think for me, and somebody who knows me really well says they thought I got a little emotional on the floor when I was closing on this bill, because is that important? Is that important to me? I think it's that important to all of us. And when you're privileged to do the work that I do, and quite frankly, you get asked to do something, or be involved in anything, and this is other bills that I know will make a difference for our state, for every Floridian, those who are here, and the 300,000 who are going to come this year, along with all the others. We want it. I don't want people in other states who are thinking about moving here to ever think, well, I hear there's a healthcare is really hard in Florida. What I want them to know, and they know now, is we're facing the same challenges as other states. Texas is our big competitor. We got to be better than Texas, but Texas is our big competitor as far as recruiting healthcare providers. But I want people to know you get great care no matter where you live here in the state of Florida. And legislatively, we're doing what we can do, but I think communities need to step up, and probably want to step up and be part of that. So thank you, and thank you all for being here this morning too. Thank you.